Hi guys, welcome back to my channel. My name is Londiwe Clever. Today's video will be focusing on the symptoms that my son had when it came to ADHD and autism. So a little background check on this is that from birth, which is January 2016 until April 2017, my son was developing very well at the required time with each milestone that he had to go through. So in April 2017, he fell sick, he had flu, which led to him to get an operation. So after that operation, he started the whole healing process. So when he healed completely, his speech just stopped. Like we had a 15 months who was like an infant basically, which was very sad and scary, but we thought that okay, maybe he'll pick up as he has healed. You know, that thing of if kids are always sick, they kind of like go backwards in terms of their progress. So we also thought that this was the same thing, that he's just going backwards, then he will pick up again where he left from. And a few months later, from the whole healing, process, he did not pick up. It just got worse. It went from the aggressive to the head banging to him just struggling to relate to other people, for like other people or kids, guys, like the simple communication skills for kids. Things went south. So because now we saw that he is just not improving, we thought like he should go to a doctor so that we find out if he will get better. We should just wait a bit, or now he needs proper assessments and medical attention. So with his first consultation, of course, we got the news that he needs to go for assessment, because now, since he's not talking, we're not sure that maybe is he even hearing, because you'll be calling him, he'd be saying, go take this, go take it. Like he would just not do any of those things. You know how a child does not speak, but you're like, oh, he was not doing all of those things, guys. Like he was not doing anything. I don't know how to say this any better, but it was just hectic. So the doctor that we saw for that consultation said that he must go for ECG scan. He went for CT scan. He also had to go for assessments for audio for his hearing, just to check if he's actually hearing. These things that I'm listing, he did them in one hospital. He had to see a speech therapist, of course. So the ECG scan, guys, that appointment was hectic because the guy did not want to fall asleep. The CT scan, he did not want to fall asleep. The audio, like he did not fall asleep in any of these scans or assessments, which was so hectic because that means that the doctors and the nurses, we were working around his schedule, because the way, guys, he was so scared. Because I don't know why they make those rooms to be so scary. Like they're just cold and quiet. And imagine you're a child and you are so scared. So he did most, like the ECG and the audio. I think I was like, he was on my back. And for me, I actually did not like to carry my son in my back. Like I was more of the front with the baby carrier. I didn't even use the whole blanket and what I didn't. Like my grand would be like, "I get Nina." You'll think I just civilized, but I just did not like the whole thing of carrying like my son like on my back. And with the CT scan, we both went inside. Basically, I had to be on top of him and calm him because he was moving around so much that they couldn't get a proper scan of his brain. But all of those scans and assessment, they came back, they were fine. Like it showed that he was fine. So since he was fine and it had nothing to do with his brain and whatnot, it moved now to the speech, to work on the speech. Maybe the speech will make him better and he will go back to normal. So we started the speech, and I think we started it in 2018, definitely. It was 2018 because I remember that the first scan, it was done in March. So all the scans though were done in 2018. So 2018 he was going for speech. So he's doing all of these things. I live in Pretoria, right? And he was still based home. So I would travel because I just wanted to be involved and to be the one who's attending and pay attention, because I just felt like I must be fully involved in his development and what needs to be done for my son. So I'll travel maybe a day before or 2 days before the appointment, maybe stay a few days, or even travel back the same night. So I just had to always travel back home, and you find that the doctor will ask important questions, or the therapist, even if at home they told me things, you find that I would even forget some things. Then when we are done, and I'm like, oh my goodness, I forgot about this. Oh my goodness. And it used to make me feel so incompetent in raising my son, or even like to maintain the information in my head so that I relay whatever that was said to the doctor or the therapist. So, but that was in 2018. So that's when I thought like, I think let me just ngithathe umthwalo wami ngizohlala nawo properly so that I'm fully involved and I'm aware and I'm handling his day to day, and it's easier to keep track of everything, so that when I report back to the therapist or the doctor, I report the full report because I see it every day and I implement whatever has been said. So 2019, I decided to come to take him, and we've been living together since January 2019, which was hectic. So I'll be talking about is the things that I saw for myself, not being told, by Okoko and stuff. But now it's things that I saw for myself. So what I saw when it came to his symptoms or signs of autism was definitely being aggressive, definitely speech delay. Speech delay, guys, is part of autism. Like, any delay, mental speech developmental delay can be also part of autism. So he had speech delay. He was not aware of his surrounding, guys. Like, guys, we can joke about it, but it was hectic in a sense that if you went with him to the mall, like, how, guys, I don't know how to explain it, maybe because how I was as a child, but he was just overly excited. Like, he would want to run off and not be scared that I'm in an unknown place and I don't know anyone here. Let me stick to someone that I know. He was the totally opposite of that. If you reprimand him, try to discipline him, he will like retaliate by doing head banging, which again is a serious issue because could lead to serious injuries. Then he would even go, "Argh!" And you see that, hey, ingane, if frustrated, ingane is going through. So now this is in 2019. I'm seeing all of these things, right? And he would do the head shaking. I remember like he did the head shaking like before we went to the doctor's appointment for his follow up. I think it was a 6 months or was it 3 months just assessments by the doctor. So when I raise it up, that like my son now does the whole head shaking thing. So of course I was now kind of like I was researching on his behavior and what he does, and I could tell that they speak about autism. Then you remember like things that you used to learn in high school, that oh my goodness, here it could be bad here. So when I told the teacher, not the teacher, guys, the teacher, when I told the doctor, she said that it's best for him to be transferred to the Kids and Children Hospital to do further assessment, because she suspects. So now this doctor that who referred us was a female, because she suspects that he could have autism and ADHD. So then we got transferred to the children hospital, to the Kids and Children Hospital. Then when it came to ADHD, D is attention deficit hyperactive disorder. That's what it stands for. And of course, the full name for autism, it's autism spectrum disorder, because the autism spectrum is quite big. Back to ADHD, so you find that here he's hyperactive, like he can't sit still, he's like he busy ngani, can't just sit still. We could be anywhere, at any time. Wavuka nje nangumuntu. And of course, guys, there are levels of being hyperactive. There's the hyperactive and there's that hyper. So of course he was, akakontroleki, being not in tune with his emotions. In terms of focus, the way he's trying to tell you how he feels, it comes across in a very negative way for his age. instead of him crying, you find that he's biting you, he's doing the head banging, like, at the same time also he is not aware of your emotions, like, he could just go, so, oh, mommy is sad, please don't do that, I am happy. Like, he could not relate emotionally with adults, especially kids. He could play, like, he would play alongside with kids, but not with kids. And if I could just add on again to the autism part. So, guys, autism, it has also this thing of kids not looking people in the eye, not liking bright spaces or bright rooms. So he was not like that, but he was just more of, if he's in a room full of people and there's noise, that he'll be overly hyperactive. He'll be also doing the screaming, like everyone now will turn around and look at him. That's how it was. He was not in the one that can't take you anyway. And what him, you can't take him anyway because he overdoes it, basically. Now, coming back to the ADHD, of course, the concentration span, not there. Paying attention, la corner, it does not exist. And I'm not saying this in a bad way, but guys, at a certain age, a child should be able to pay attention for this period or this duration. So you find that him, no. So overall, when I speak about these two things, it was just hectic. This was behavior side and his day to day, how he handles his day to day. If I can touch on speech, our first session with the speech therapist in 2018, I remember her telling me that my son, who was over 2 years, has a speech of a 12-month. So that means we are over 2 years and you speak like a 1-year-old. That's where he was. So with speech therapy, that meant that we had to help the child with necessary tools to reach the age group that they are in. Guys, these three things, speech, autism, ADHD, it's a lot of work because basically you are molding the child to fit back in the normal setting of society. Like, it is hectic. I know, I'm not even going to lie. It is hectic. It takes a lot of willpower, one, self-discipline by the parent. When I say self-discipline, I'm talking about a parent knowing that they have to be fully involved in the child's well-being and the development. Okay, I don't even want to touch a lot about how parents should be when it comes to special needs kids. These things are interlinked or intertwined. These were the symptoms that he had that led to him being diagnosed in these three things. Okay, maybe in these two things because speech was very obvious. Like, even now, he's 5 years. I think he's 5 years, 6 months, but his speech is not of a 5-year-old. So that's a different case altogether. But these two things were just so heartbreaking to see what my son used to go through. Like, guys, you should see how frustrated that he will get if maybe he wants something and I'm not understanding what he wants. Like, you could just tell that the child is frustrated that I can't communicate in the way that you'll understand me. Like, I'm even getting so emotional right now thinking about it because the way it was hectic. Those were the symptoms that he had. And of course, hey guys, sis, I feel like it's funny to see a con. So yeah, guys, this video I thought I should talk about what my son used to do, speaking in past tense, basically, because he is not doing a lot of those things that he used to do at 2 years. Now, guy is sitting at 4 years, even though he's 5, but his behavior and everything is at 4 years. The speech is at 3 years something, but huge improvement. Guys, we've come to the end of my video. I hope you guys like this video. Please do subscribe, like, and comment. Guys, please share my video with anyone that you know who could appreciate my video, who is raising a special needs child. Bye, guys.